Good morning, everybody. My name is Robin Kolbeck, and I'm the Senior Vice President of Business Development here at EPL, and we appreciate you being here today to talk to you about an important topic changing in the marketplace, and that is our healthcare arena. Our vision is for your credit union to play a key role in helping your members and potential members navigate the complexities of healthcare. EPL is a core technology company, and we're committed to empowering our customers to drive their business from the member perspective. Our goal is to provide leading technology solutions that are going to enable you to compete effectively in the communities you serve. With that in mind, we know there are a lot of challenges facing credit unions every day. And as members, we're dealing with new issues around healthcare reform that's impacting what's important to them. We're really excited to share this new opportunity, and we feel it's important that credit unions can help be a leader to strengthen your relationships with your members through this opportunity in the community you serve. We feel this is a natural extension for your credit unions to leverage their position as a trusted resource, and where their members can come to you to seek advice, options for coverages, and relationships to build their revenue for your credit union. What we want to cover today, we have an opportunity to believe is good for you. The Affordable Care Act really has dramatically changed the landscape for health insurance that started today. And what we want to share with you is an overview of who EPL is and our partner with Health Partners of America, talk a little bit about the health insurance environment, share with you how you can become that community hub for your credit union and your members, and also to introduce a new program called the Credit Union Exchange Blueprint, which is a turnkey solution for your credit union that's going to enable you to provide the expert insurance assistance to your members. We're going to talk a little bit about the online marketplace and the portal for you to offer a solution for the health insurance market for your members. We're also going to talk about the support for success and how we built a turnkey solution for all of you. And then we'll finish up with some Q&A. EPL, our values are built around connecting people, process, and technology. And we believe the Credit Union Exchange Blueprint is a shining example of that mission and our core values being brought to life. By connecting the credit union to leading-edge processes and technology, supported by the expert people and our resources, we believe the credit union is going to be positioned to help your members, employers, and the community you serve at a critical moment when they need the greatest assistance and support, and helping them be that trusted resource for healthcare. Being located in Birmingham, we have a unique opportunity with a leader in defined contribution plans and establish a partnership with Health Partners of America, who is a leader in this industry. Today, Health Partners of America serve many brokers throughout the country to provide them the tools and the resources and training for their customers. We have worked with them exclusively to take the tools for their customers and credit unionize them. And that's how we created the Credit Union Exchange Blueprint, which is here headquartered in Birmingham, and it's the country's first and only national marketplace for health and related insurance built exclusively for credit unions and their members. We know you continue to face challenges as credit unions in dealing with more than normal business challenges, such as pressures on margins, need for income, member and lending growth, and overall retention. It's a tough place to continue to maintain that position at your credit union while dealing with the economic and obviously regulatory changes that you sure are getting. We assume you're probably getting many questions from your members or staff regarding what we're hearing around the healthcare reform changes and the impact this is having on all of us. With the Credit Union Exchange Blueprint, we really want to share with you some of the strategies about this new opportunity. We really think you'll be excited about that will help you continue to be the trusted advisors to your members that they turn to by offering this solution that we believe will be easy to implement, cost-effective, and relevant to your members. And to talk about that more, I'd like to have the pleasure of introducing Josh Hildredge, who is the President of Health Partners America, that has been instrumental behind the defined contribution programs and has been a national speaker around the country to share more what's happening in the healthcare arena and why the Credit Union Exchange Blueprint will help position you in the community that you serve for your members.
Thank you, Robin. Appreciate you guys joining us today on this landmark occasion. As many of you know, the exchanges, the state and federal exchanges have opened today to great fanfare. Some of them have already shut down. There's going to be some technical kinks that are going to be worked out over the next few weeks. But the big message is, the way we get our insurance is changing. If you take a look at where we believe the next year, 2 years is going to take us, there's going to be a huge shift away from that employer-sponsored market, which today makes up about 160 million participants. The reasons are a lot of the advantages that group health insurance has had over individual insurance are gone, and then, of course, the individual market is where the subsidies that will help those that make less than 400% of the federal poverty level purchase insurance. So we'll talk a little bit more about that later, but there is definitely a shift occurring, and it's going to affect all of your members. We believe health insurance is the most topical and is going to drive a lot of the traffic and a lot of the conversation, which will allow you to take that place of preeminence and the community hub and be a leader so that your members and your communities will have a place to go to. It'll be because of health insurance, but this exchange isn't just about health insurance. We're going to talk about some of the other insurance products that can be made available as well. But if you take a look at the high and low end of the estimations of what's going to occur over the next 18 to 24 months, the CBO estimates that around 28 million consumers are going to shift. A McKinsey consulting study estimated as many as 125 million consumers. So those are all consumers that would leave the group market and go to the individual market. If you include those that are currently uninsured, those that are going to be enrolling during this first half of the open enrollment period here from October through just the end of December, you've got about 22 to 25 million uninsured that are expected to go to these exchanges and purchase their health insurance. And also those that are eligible for Medicaid. There's been Medicaid expansion in some states. All of that enrollment can take place on these exchanges. Medicare, information about Medicare supplements. So it's really a very broad and global initiative that can help all of your members understand how the Affordable Care Act is going to impact them and what their challenges and opportunities are based on the Affordable Care Act. So let's talk about a few of the reasons that the group health insurance is really dissolving. We're going to start seeing some of the renewals come out in January. We'll start seeing what's going to happen to the group insurance rates. But on top of the cost, the regulatory burden on employers, there are new notices that have to be sent out. There are reports that they have to file. There's new W-2 reporting on what benefits are being offered. They've got to deal with part-time employees and either keep them under 30 hours or provide benefits. So there's a lot of new regulatory burdens that an employer has to look at that add to the costs or the angst that they would have in offering group insurance. But we really believe that these 6 big changes are going to be what's going to impact consumers the most. The first one is that individual insurance is going to be guaranteed issue. So all of the policies that you can start looking at today in these exchanges for effective dates of January are guaranteed issue. That means no one can be denied coverage for medical reasons, and there's no lifetime limits. This is a really big deal in 45 of the 50 states who have had an individual health insurance market that has been medically underwritten. So in order to get your own health insurance, you had to qualify medically. Otherwise, you had to get insurance through an employer. So that's one of the reasons that people have gone and gotten employer-sponsored coverage, especially for really small groups. It's because it was the only place they could get insurance. But now all of the policies, including the individual policies, will be guaranteed issue and guaranteed renewable with no lifetime limits on the coverage. Number 2 is the individual mandate. So the 48 million Americans that are without insurance if they can afford it, even with the subsidy, will be required to purchase insurance. So that's why the CBO is estimating 22 to 25 million of that 48 million that are uninsured will be purchasing insurance. Number 3, the subsidies for individuals and families below 400% of the federal poverty level. Most Americans don't know exactly what those numbers look like, but for a family of 4, it's over $92,000. I'm married. I have 3 children. We could make as much as $110,000 and still qualify for a subsidy to help us pay for our insurance premiums. So this is a big deal, and 63 to 68% of all Americans will qualify based on their income levels. But if an employer offers group health insurance, you're not eligible just based on your income. You also can't be offered affordable and qualified coverage from an employer. So many employers are going to face a new reality starting in January where their employees may be coming to them and saying, hey, we appreciate that you're paying for our health insurance. We appreciate that you offer us coverage and we can add our spouses at a certain cost. But based on the subsidies that we're eligible for, it would be better for me if you did not offer me health insurance. And so that's just a dynamic that we've never had in this country, but those conversations are going to be taking place all across the country. Number 4, the new ways to shop and enroll begin today. So the individual marketplace, the exchanges, and the small group marketplace, they will have some challenges getting this huge technology pushed through and getting it functional and working. But all of those have started today, so we can start seeing what that shopping experience looks like. The open enrollment periods for the individual market this first year begin today and go through March. And then the subsequent years, it'll be October 7th through December 15th. And number 6 is the product standardization. So in addition to being guaranteed issue, the group market has had an advantage over individual insurance because the benefits that had to be offered in the individual market were not the same. The most glaring example was maternity coverage. Most carriers on the individual market did not offer maternity coverage. So if you and your spouse were planning on having children, you really needed group insurance to help cover those costs. And so now the products in the individual market will be the same as those that are in the small group market. So the coverage looks the same, it's guaranteed issue, but in the individual market you do have those subsidies that are going to help people pay for their insurance. And then of course the bottom line on the small group insurance is that it's going up. The premiums are rising. Of course the individual market's increasing as well, but it's really comparing apples to oranges because before it was not guaranteed issue and it did not have the same mandated benefits. The premiums have come out. We got the report last week, and they, compared to group health insurance, are relatively lower costs. So the individual market does look much more attractive right now than the group market for most groups. Now, depending on your demographics, if you got a lot of young males especially, you could get a better deal on the group market if you wanted to deal with some of those regulations and your folks did not qualify for subsidies. But we do believe that this is a challenge that many employers are going to need to look at and weigh out the decision of whether or not they should offer group health insurance or not. So on top of that, even if they decide to keep group insurance, a new way to communicate, enroll, and administer those benefits is through exchanges. And exchanges are going to play a significant role in both the group and individual market. And this study from Oliver Wyman, a survey of over 1,300 employers, showed that no matter the size, even as high as 3,000 life groups and above, over 70% are considering switching to exchanges for no savings or savings of at least 10%. And so we are seeing, and we've seen, the announcements recently from UPS, Home Depot, Walgreens, IBM, a lot of these large Fortune 100 companies shifting the way they do employee benefits and leveraging these exchanges. So I want to take just a minute and talk about exchanges. It's been one of the most broadly defined and maybe most confusing terms that has been out there. These are really the types of exchanges that exist. There are private exchanges, And then there are the public exchanges, which have been set up by the states, or the federal government has set them up for states that have chosen not to create their own. So the federal government's involved in about 36 of the exchanges, and about 14 states have created their own. In the light blue up here, these are group exchanges. So traditional employer-sponsored, employers are making contributions towards the insurance. It's tax-free. It's just a different way of making multiple plans available. And you've got single carrier group exchanges. You have multi-carrier group where the employer is choosing the carrier. So this is basically an online spreadsheet. And then the multi-carrier group where the consumer chooses the carrier is really more of what some of these really large groups have been able to do but have not been available in the small group market. Really the reason is those carriers can't set out a price if they don't know how many of the participants they're going to get, because insuring a 23-year-old is a lot different than insuring a 63-year-old. And if they put their prices out there too high, none of the young people would buy theirs. If they put them out there too low, you know, the older folks or the higher risks to them would buy too much. So that it's really difficult for a group carrier to price their plans accordingly. And of course, the small group shop exchange is the exchange for small groups that have been set up by the government. On the individual market, however, you do have a lot more choice, and you've got a single carrier individual model. This really, to me, is not fitting in the definition of an exchange, but a lot of the carriers that have put them up are calling them exchanges, so it causes some confusion. To me, the exchange, or the idea of a marketplace, is really having an Amazon or Travelocity type feel where you've got a lot of choice from different carriers. And so a multi-carrier individual exchange, which is the heart and soul of the credit union exchange, Blueprints exchange, gives each individual those choices from any of the carriers that are available in their state, but it also is able to connect them to the state and federal exchange if they qualify for subsidies. And so this is something many people were not aware of because it was not part of the original Affordable Care Act, but based on survey results and a realization that these exchanges and connecting people to these insurance products was not going to be successful if you did not include the brokers and the private market, that this just would not go well. They have opened the doors and created different pathways for a private exchange to actually facilitate those subsidies that someone might be eligible for. So if we think about an exchange as an online marketplace, it's a multiple carrier venue for insurance policies. And as I mentioned earlier, it's not just health insurance. So if you go there for your health insurance, you may want a critical illness or accident or dental, vision insurance, life insurance, disability insurance. All of the insurances that really go together to form the most effective and efficient way for you to finance potential risk of loss due to your health circumstances or even death in the case of life insurance. And so you've got one advisor to deal with, one expert that's licensed in your state that can help you understand how these insurances work together and really how to make the most of your money. And so it is really like a Travelocity or Amazon with the added benefit of having an expert that you can be on the phone with during that shopping experience. There was a report in Bloomberg last year that the eHealth-led exchanges, when it was announced that the private insurance exchanges could be facilitating those subsidies and let them sell the government-subsidized coverage, they were only estimating the 22 million uninsured Americans when they came up with that $4 billion. So if you add in the 28 to 125 million that's anticipated to exit the group market, we see that there is a tremendous amount of opportunity here. And we believe that there is a unique place for a credit union to be able to take advantage of this opportunity that's been created. Employers and consumers, which make up, a credit union's members, need to be connected to those insurance professionals, to third-party administrators, to health insurance carriers. And what better way to do that than through a credit union exchange powered by EPL? You're able to help the employer continue offering benefits, understand some of the new strategies around defined contribution, and you can help the consumer, making it an easy shopping experience for them. Now, one of the things that we found unique, and we work at HPA with the insurance producers, brokers that deal a lot with employers, but if you look at a survey that was done by Prudential, 79% of employees view their employer as a trustworthy source to help them grow and protect their money, second only to credit unions at 81%. So you guys really do have the lead seat there in who your members are going to look to, and for you to be able to have a turnkey solution like the Credit Union Exchange Blueprint that gives them the knowledge, the tools, and of course the technology to plug into and understand what they should be doing in lieu of health reform as an employer, as a consumer. It gives you a huge advantage and really helps your credit union become that community hub, because you've got your members and you've got the employer groups that are your members, but you've also got the community, the potential employer groups and potential members that are out there there's really a vacuum of information. I've found it amazing even this week to see some of the surveys that have come out of just how uneducated Americans are about health reform, that over 40% still don't even realize that it's a law. And a lot of the provisions are going to be going into effect in 3 months. Some have already gone into effect. Of course, the exchanges are opening today. So why the Credit Union Exchange Blueprint? It's created solely for credit unions, provides a unique support with software training, education, and marketing. The private exchange technology solution with broad insurance participation. We've got over 100 carriers participating in these exchanges. It's a dedicated resource, our online portal, the CRM or client relationship management tool to track any of the people that are visiting the exchange, plus the trained and licensed agents in all 50 states. There's tremendous value for the credit union, for their member, and for their community. We really believe that having a trusted source to go to is going to be more important now than ever because of the confusion and because of the lack of trust in the government. So these government exchanges that open today are already failing, and of course that's being a broadcast and it's going to be all over the news. So having a trusted entity to go to that won't fail them is more important now than ever. And their value to the member to protect their assets and what matters most is also an important reason for us doing this. The increased revenue in the deposit accounts for the credit union through the insurance products, the new marketing avenues for financial products. So if you're marketing right now a loan program or certain advantages that you think you have, the amount of traffic and new folks visiting any of the sites that have this exchange linked to it, if any of the marketing that's going on is going to generate a tremendous amount of traffic that you can use to market your other financial products. You can also replace some of the other streams of revenue that are being attacked by regulation, increase the value of that credit union relationship, and if you offer health savings accounts or premium accounts, so for the defined contribution concept, and because many people are going to be paying for their health insurance premiums for the first time, they may want to have a segregated account to keep that money in so that it doesn't accidentally get spent and their insurance policies lapse. Of course, the credit union members themselves, by being covered, will help protect the credit union. It'll protect any of the assets that you're currently helping them manage, because the uninsured and underinsured are at a risk for depleting their savings if they have a medical emergency, cashing out CDs and other investments, and even defaulting on loans. And so making sure they're connected to the right insurance plan is important for them, but it's also important for you. We talked about the new types of deposits with health savings accounts and premium accounts and some of the increased revenues that are available. The credit union win, being able to leverage our knowledge for your credit union. So this is not something new that you've got to dedicate a ton of your staff and resources to, because it is a turnkey solution that's already been created. You can increase your credit union membership, offer strategic growth products and services, strengthen member and community relationships, and generate non-interest income. You'd be able to elevate your brand and bring new relevance. Right now, some of the credit unions that have already come on board, we're planning some community events. They're doing some launches, and they're getting a ton of good press and buzz around the fact that they're trying to tackle this, not in a political way, but in a solution-oriented fashion. You can activate new employee and employer benefits yourselves. You as a credit union are an employer and would want to know how the health reform law is going to impact you. Become a national leader and prominent exchange expert, and provide a trusted bridge to the subsidies millions of Americans are going to qualify for beginning in 2014. So I want to talk for a few minutes about the product itself. The Credit Union Exchange Blueprint is made up of 4 key components. There's the online marketplace that the consumers enter. There's the private exchange administrator area where all of the training, the marketing tools, the customizable sheets and presentations, a wizard to make any changes to your consumer-facing site are all in that administrator area. And then the CRM allows you to track all of the leads and activity that's going on in this online marketplace. And then, of course, our call center staffed with insurance agents licensed in all 50 states. So on the Credit Union Exchange marketplace that is branded for the credit union, the color scheme, the products that they want to promote, it also allows them to connect to the insurance products and promote insurance products even if it's not products that they want our call center to fulfill. So if they're currently in a relationship with someone who's handling, group health insurance or life insurance or property and casualty insurance, we're able to support those existing relationships and generate more leads for them. Here's a view of some of the templates that can be used as a starting point for creating those online marketplaces. Number 2 is this private exchange administrator area. This is a password-protected portal containing valuable tools and training for marketing the exchange and understanding in layman's terms what's going on with health reform so that your staff and team can be trained, again, not so that they have to become experts and dedicate a lot of time to this, but so that they feel comfortable knowing that the exchange that their credit union has decided to set up has all the answers, has the resources that their members are looking for. And then, of course, here's some screenshots of what that looks like, some of the marketing that's in the toolbox, postcards, staff buttons, banner ads, brochures. And then the Exchange CRM, known as Blueprint Expert, is a state-of-the-art customer management system. So all of the activity, if somebody goes in and looks for a quote for health insurance, you're able to see all of that activity. It's a great way some of our credit union partners that have already come on board are using that data and cross-referencing it with current members versus prospective members, and are able to turn around and go after folks that are visiting the site and say, hey, check out what a membership at our credit union looks like. And they've got new lists to be able to market to. And that also allows you to manage where the leads go. And so for the products that you want us and our call center to be able to sell for you, or for products that a credit union or a referral relationship that they currently have would want to sell, it allows the custom lead routing based on the lead type. But in that, you've got full reports, who's calling, who's clicking, who's purchasing, what they're purchasing, all of the details from the Fulfillment Center. And the Fulfillment Center itself is staffed with insurance agents licensed in all 50 states. They do share the revenue when those agents close the deal, and they do have customized scripting, so they are able to present themselves as a representative of that credit union. The call scripts, the instructions, the customer service standards are fully customizable, ensuring a smooth experience for your credit union members. They are licensed in all 50 states. They work extended hours, even through the weekends. Very professional, very good at what they do, have a high cross-sell rate. So they're experts at pairing health insurance with accident, critical illness, dental vision, all of the right coverages that a consumer may be looking for. They also do outbound calling every 90 days to ensure that the customer is still happy, answer any questions that they might have, and make sure that that customer knows where to go to for expert guidance. So really, when we take a look at all of the components of the Credit Union Exchange Blueprint, we like to say we offer very broad capabilities, but focused execution. So one of the parts of the process to get started is to meet with a credit union, their strategy and marketing team, and talk about who some of their sponsor groups are, who they think would want to hear about this, and how they want to bring this to their community. And so it's a great way to be able to provide very focused execution for whatever that credit union is wanting to accomplish. But they do also support the existing insurance relationships. You own those relationships. You support we can support the existing QSOs, and it provides new capabilities without having to create a QSO. So what makes this unique? It really is a true end-to-end solution. Complete member experience from education all the way through plan selection and service, and allows complete customization with site branding, lead direction, which products are being offered, and promoting both group and individual solutions. The financial investment for a credit union to get started, right now we're looking for our charter members, and the charter members only have a $7,500 installation fee. And that includes the web portal, the CRM, the initial training and marketing materials. There's a $750 monthly ongoing investment. That includes the support, the updates, and the ongoing training. Credit unions receive a revenue share based on member participation. An average size credit union can see a 300% ROI in the first 2 years, and it can continue to grow over time. So the support that's being offered, the education and training, the software, the expert assistance and updates, as well as marketing support, so outreach tools for members, communication tools for the credit union. We're providing webinars on the first and third week of every month, providing industry updates to credit unions and helping them understand as the market continues to move around and health reform continues to impact us all. We'll be giving the latest and greatest on those webinars. And we've got a Credit Union Exchange Blueprint team supporting you every step of the way. Our process is pretty simple. They get started, we get the team and marketing plan ready, and then we help them get the word out. And we've got the staff, the support, and the tools to help them every step of the way. So the bottom line is the landscape is changing. As an employer yourself, think about it. Are your health insurance premiums going up or down? How are you equipped to deal with the Health Care Act required changes? Would you like to be a community hub for your staff, your members, and the employer groups? As I mentioned earlier, there's a void in the marketplace right now. Employers and consumers are looking for solutions, and the person they most trust for these types of solutions is their credit union. So to us, it is just a perfect time and perfect opportunity for credit unions to really take the next step in their member relationships and their community relationships. So with that said, I know we've got a few folks on the call. Let me see if we've got any questions that you're able to type in there. Or you can, I think if you raise your hand in that panel, I can unmute you, but I think I'm only able to do that if you raise your hand. So if you want to ask a question, you can either type it in, or if you want to raise your hand, I can unmute you. We'll give it a second in case we're typing here. All right, Robin, doesn't look like we've got any questions at this point. Is there any final words you'd like to say?
Yeah, I think as far as next steps, we appreciate the opportunity to share this information with you, and we would look forward to having conversations specifically with you and your credit union on how you can be that community hub and extend the type of services to help your members navigate the healthcare arena. To look for additional information, you can go to our website, and our website will give you all the information as far as the upcoming webinars to learn more about the Credit Union Exchange Blueprint and how this can benefit you as a credit union. So we encourage you to come visit our site, look for the additional webinars. Our next webinar that we have scheduled for our clients is next week on the 8th at 2 p.m. Central Time. We look forward to hearing from you on how we can help you service your members in this community and help them navigate the complexities of healthcare. Thank you, and have a great day.